Ay, yeah. Ay, ay.
Miracles come while we in the fight. Don't give up and hold him tight. You will have a visible battle scar, but never forget who you are and fight, fight, fight.
Hello, and welcome to Embracing the Fight. I am Erica Lamar, your digital creator and host. I created Embracing the Fight so we could normalize a conversation surrounding physical and mental health issues and concerns. Now, why would I do that? Well, think about it like this. When people have an issue or they have a problem and you bring it out, people tend to look down on it or they have their opinion about it. And people like to hold things that aren't quite right about them close. So, to help start this off, I'm telling you my journey about thyroid cancer and weight loss. So, as of late, I haven't had a whole lot of updates concerning my health. However, I actually have two that I can share. So on Tuesday, I had to go to see my primary physician. For some reason, the company that I'm supposed to go and have the radioactive iodine done through, they were saying that I needed some type of authorization. And that wasn't something I'd ever heard of before, considering I was already seeing a specialist who said that I needed to have the radioactive iodine. So the people that we were trying to get this done through called the doctor's office and basically told them, and they called me and told me that I had to get, cleared from my primary doctor. So that poses a bit of a problem because I had just switched, primary doctors because of the lack of confidence that I had at the one that I had previously. So I'm not saying that to say anything bad about a previous physician. She just wasn't, for me. She didn't suit, my needs. So now I have this new primary medicine doctor, and I've only been to her office once. And the one time that I went, I didn't actually get a chance to speak with her. I actually spoke with her. I want to say he's like an assistant physician or physician's assistant. And he had done, blood work and everything on me. And it was interesting because he did such a thorough and good job. I was like, it'd be cool if I still, went to him. However, I'm glad that I went ahead and made the appointment with her. And I'll explain why. So imagine I'm going into the doctor and I'm thinking I need this authorization. And she just says, have them to send your medical file over. So I called my endocrinologist and I asked her to have my information sent over to my primary doctor. So they did it. Well, anyway, on the way there, I get a call from the company that's supposed to be, setting up the RAI. And they say, oh, no, you don't need, this authorization. Your endocrinologist is, completing all the information for you. So now y'all know what happens if you call the doctor's office less than 24 hours to try to cancel, right? You know what happens. So I just said, let me go ahead and do this visit because I need to meet my primary doctor anyway. All right. So when I get there, I have the best nurse. He is the funniest guy. Well, anyway, we were born around the same time. We shared a lot of the same interests. Most of us play tennis and all that. And I told him, some of the things that I had going on because, he's preparing this information, for my doctor, which is great, because once she comes in, I imagine she's going to go through everything. She's going to answer all my questions and then we're going to go. But I noticed, that I had this nagging pain in my right knee. Well, it's not actually in it. It was like on the outside of the knee near the back. And I had played tennis on Saturday. Well, my knee didn't bother me on Saturday, Sunday, Monday. My calf was what was bothering me. I was like, why do my calves hurt like this? And of course, the first thing I thought was maybe it's a blood clot, because you all know that I have factor V Leiden, and that's where my body is predisposed to creating blood clots. And I knew I hadn't drank enough water, and I hadn't consumed enough electrolytes. I was doing all the wrong stuff again. So anyway, I'm sitting there and I'm thinking, well, what is that? So while I'm here, I might as well, just ask. Well, anyway, she comes in and she has this young woman with her. And I want to say that she is a student, and she is starting, I don't know if she's in medical school, but I'm thinking she's a student of some sort. She even told me what her name was and exactly what she did, but I was really trying to focus on the questions that I wanted to ask the doctor. And I said, next time, I'll exchange pleasantries again with this young woman, because she was really great. She was really nice, and she was transcribing, everything, and she understood all the medical terminology that was being used during the visit, as did I, which was, pretty cool anyway. So while I'm sitting there, she asked me, what was the purpose of my visit? And I told her, well, initially I came here because I need an authorization, concerning the total thyroidectomy that I had done. And that this particular company said that I needed to get, the authorization from her. Well, she explained to me, she was like, well, you don't need authorization from me, because an endocrinologist is a specialist that can give you that authorization directly. It's not something that she has to do, considering she hadn't seen me. She was like, but let's talk about your medical history. We went over everything. And once we finished talking about the different surgeries and things I had, she was like, okay, so what other, issues or what other things do you have that you're concerned with? And when I was telling her that my knee was bothering me, she asked some very detailed, very good questions. And she was able to feel and touch my knee and basically tell me a lot of the things that I had been told previously by an orthopedic surgeon, who sent me to have MRI, X-ray, all that kind of stuff, before they could really tell me, what was going on with my knee. And then she explained that the pain that I was having didn't come from like mild arthritis, that it was 9 times out of 10, a strain, a muscle strain. So I had been treating it wrong at home. I had been putting heat on it. She was like, no, rice, rest, ice, compression, elevate. All right, got that down. So I said I was going to do that, as soon as I got home. All right. So then the next thing she said was, well, do you have, anything else that's going on? So I explained to her, I said, I've been talking to my different doctors about the excess hair that I have, underneath my chin. So I was saying that, it's not that it's painful or anything like that. It's just unsightly to me. I like to see, smooth, even skin, and here I am waxing and doing all these different things, and it's leaving these marks, and I just don't like it. I want to go away. And I'm like, I really don't care to use lasers. Is there something else that I can do? Because my endocrinologist said that my testosterone was fine. So she says, let's see what fine means. So she opens it up and she says, well, when I talk with her, or basically looking at her notes, it says that it's slightly abnormal. So that doesn't mean that it's fine, but that doesn't mean that it's horrible either. So she was like, there are several, things that can potentially cause this. It could be genetics. It could have something to do with weight gain. She also talked about PCOS. And at one point, I was like, okay, well, I had several fibroids, removed. And I was thinking that, the facial hair was going to go away. And then she was like, no, you can either treat it like with birth control, or do it with a topical cream, or you can actually go and have some form of laser done to make it go away. She said, but yours could just be genetic. It might not be this slightly abnormal, slightly elevated testosterone. It may not, be that. So then we continued to talk, and she was like, well, maybe, you're glucose resistant. So she's looking and she's like, oh no, your glucose numbers are fine. Well, then she flipped over some more. She's like, wait, were you fasting the second time they took the glucose? I said, no, I wasn't. I said, the first time I took it, I was. And she was like, okay, it's perfect then, because it was under, it was under 100. So she was like, well, let me keep looking and see what I see. So she's looking, she's flipping. And she says, has anyone ever told you, that your potassium is low? And I told her, I was like, after surgery, yes, I have been told that my potassium was low. And she was like, well, did they say anything? I was like, yeah, they told me to try to consume more bananas and, beets, avocados, things of that nature, because I don't want to add any more supplements, to my little list of stuff. So she was like, well, you do know, what impact that can have on your heart if you don't have, a normal or the right level of potassium, in your blood. And I was like, yeah, I understand that. So she was like, we're going to do this. You're going to try to change your diet for the next couple of weeks. And then you're going to go and give a sample and we're going to test your potassium. So because it's either the blood pressure medicine that you're taking that's robbing your system of potassium, or it's genetics, it's something else is causing this. And she said, if it's your blood pressure medicine, then we can change it. And I was like, well, isn't it just the water pill that I'm on? She was like, well, it is a water pill, but it also has blood pressure medicine in it as well. Because in my mind, I'm saying to myself, oh, it's just a water pill, I can lose weight and, I won't have any more issues. But then that would make too much sense and I should have lost weight by now, right? All right. So then she says, we may be able to switch you to something different. And I asked, well, if it's going to add potassium, is it going to be one pill or two? And she was like, well, let's try changing your diet first. And see, that meant a lot to me, because there are so many physicians out here that are quick to give you something synthetic to put in your body to replace the things that you can get from nature. And she was more about, eating right, exercising, drinking enough fluids, things of that nature. Not just here, take this pill and all go away. And she continued to look through the rest, of my blood work. And she told me, how everything, looked, really good. But I should focus on exercising and removing certain things out of my diet to get to a healthy weight. And all during this time, she made sure she went over everything, even down to the point where she asked me how I knew that I had factor V Leiden. And then I started talking about my neurologist and the different tests that were done. And they found, a suspicious, they say, blood clot on my brain. And then I'd had one, on my leg, and I had a TIA and some other things. And she was just like, wow, okay. And she asked me, well, okay, so once they figured that out, what did they do? I said, they sent me to a hematologist. And the hematologist is the one that explained to me, about the factor V Leiden. And it was all in the neurologist's report. And she told me that that's why they were having to place me on Eliquis, and it would be, lifelong. It wasn't going to be something that I could just stop taking whenever I wanted to, because, what happens when you stop taking medicine, that symptom comes right back, if not worse. So here I have an amazing primary physician, endocrinologist, neurologist, OBGYN. I would say hematologist and surgeon, but they're done with me now. But these other 4 doctors are with me until I decide to leave them or they retire, because the level of care that they have given me has been absolutely outstanding. And it all started with my OBGYN. She is absolutely amazing. This lady took one look at me and it helped to find that I had thyroid cancer that I probably had, for quite some time. And all it took was her to look and to care. So when you're going to see your doctor, make sure that you take the time to write down the things that are giving you an issue. If you can't remember to write it down, If you got a cell phone, do a note every time something goes wrong. Like if you stub your toe, bump your elbow, or you have a headache a certain time every day, or your teeth hurt. I mean, anything. Make sure you write these things down. So when you go to see your doctor, it's not just the, oh, I'm fine. And then the next day you're like, dang, I had all these things wrong and I didn't check any of it out. So you have to be diligent about your own care. And then on top of that, if you have elderly parents, or if you are a caregiver for someone, make sure that you know as much as you can about their medical history. That way you can help them as well. I mean, imagine if, say, you have a parent that has an allergy to morphine and they have some type of procedure and they give them morphine. That's not going to be good for them. So you need to know what it is that your parents are dealing with, or the person that you're caring for, what they're actually dealing with. And then when it comes to you, for sure, make sure you ask all kinds of questions. And if you feel like the doctor is not answering you fully, or you're not getting, the bedside manner that you think you should get, you don't have to be tied to that particular doctor. I know people want to be loyal because, oh, they know all about me, and no, I don't want to talk about some embarrassing things, all over again, depending on what you're going to the doctor for. But this is your life. You only get one. So make sure you're taking the very best care of yourself that you can. That's what embracing the fight is all about. It's not just a fight against, someone calling you crazy, or someone, saying that you don't necessarily fit in. It's sometimes a fight against yourself for being silenced, for fear of someone thinking that you don't know anything, especially when you're asking, simple questions about your body. It's like, well, how the heck are you living in your body all this time and you don't know your body? So don't be embarrassed when you go to the doctor. Make sure you bring everything up. I do. Sometimes I think I might go a little too far. Maybe. I don't know. You have to ask my doctor, but they can't tell you because, HIPAA laws won't let them tell you. But anyway, just make sure that when you go in there that you feel comfortable. Don't feel rushed. Don't feel like you have to be pushed out of there because there's someone waiting behind you. I mean, I understand it's one thing to be courteous, but why would you be courteous at the expense of your health? That is not a good idea. So thank you again for taking a moment to join me in embracing the fight. I am Erica Lamar, your digital creator and host. Have an absolutely amazing day.